IDD computerized spinal decompression therapy is a non-surgical treatment that first became available worldwide in the 1990s. Currently, there are over 800 clinics around the world offering this innovative treatment, but surprisingly, IDD was only introduced to the UK in 2008. We decided to offer IDD therapy because we wanted to do more for patients suffering with chronic neck and back pain, trapped nerves and sciatica due to bulging, dehydrated or degenerate discs in the spine. These conditions are notoriously difficult to treat with manual therapy and exercises alone, and for some, prior to the availability of IDD therapy, the only option was long-term painkillers, spinal injections or surgery. IDD uses advanced computer technology to target, then gently and rhythmically distract very specific segments of the spine. This creates a vacuum effect to decompress the damaged disc, reduce disc bulging, improve fluid and nutrient reabsorption back into the disc, and improve mobility in stiff ligaments and spinal joints over a 6 to 8 week course of treatment. These MRI images show the before and after effects from a standard 6-week course of treatment. This patient had had severe sciatica for over 6 months prior to coming to us. Here you can see the disc bulge on the targeted segment had virtually disappeared compared to before, and by this stage he was completely free from his sciatica. And here the before and after MRI images show similar improvement in a patient with disc degeneration in the neck. There can be contraindications to IDD treatment, for example, severe osteoporosis, spinal fracture or tumour, and certain disc tears. And IDD is not necessarily the best treatment for everyone, which is why it is important to have an initial assessment including reviewing MRI scan results and assessing the flexibility of the spine and the body as a whole. We can then give an honest opinion on the extent to which IDD is likely to work for you. To optimise the benefit from IDD, we strongly encourage patients to perform simple stretching and Pilates-style core strengthening exercises at home, and we have designed our own 8-week exercise programme to run alongside the course of IDD therapy. You receive a booklet detailing each exercise and have the opportunity to receive one-to-one tuition from our trainers. We also suggest wearing a lumbar support belt in the hours immediately following IDD treatment and to apply infrared heat for at least 30 minutes each day to promote healing, as well as using ice packs where necessary. The aim of treatment is to make your discs healthier, with a more flexible, stronger spine with better posture, and to give you better knowledge of how to sit and lift properly without injuring yourself again. There are a number of features making IDD more advanced and successful than traditional traction, such as the way IDD can target specific segments of the spine, the slow sinusoidal waveform with which the distraction force is exerted so as to minimise muscle spasm, and the ability of the machine to deliver a variable oscillatory distraction force at high tension. This last feature is patented and exclusive to the IDD range of spinal decompression machines that we use. There are also sensors built into the onboard computer that carefully measure the flexibility of each patient's spine and allow any resistance from the patient's tissues to be monitored both during each treatment and from one treatment to another. Medical trials show success rates with IDD of around 70 to 90%, and since using this groundbreaking technology, we've been able to help many more patients who had previously not responded to treatment and who are considering surgery. Here are a few of our patients to tell you about their experiences with IDD spinal decompression therapy.
Before I started the IDD treatment, I was struggling to walk more than a mile. Previously I'd been walking up to 20. Extreme sciatica down both legs, and very severe pain in the lower part of my back. Discomfort standing around, couldn't really spend any time in the kitchen, couldn't cook, and generally not able to be in a position where I had to stand on my feet in one position for longer than 2 or 3 minutes.
After suffering from sciatica for about 16 months, and the condition was very dire. I was walking very badly, tilted, in pain most of the time. Prior to the IDD therapy, I have had other treatments such as physiotherapy and acupuncture, and those proven not to be so effective.
I'd had 4 years of solid and very severe lower back pain. I tried a number of different treatments and hadn't really worked. So when I saw the IDD and the treatment that was offered by the clinic, I rapidly took it up.
Probably midway through the treatment I started to notice a significant improvement, certainly as far as my walking was concerned. I'm back up to walking in excess of 10 miles now without any ill effects whatsoever. I can cook, spend a lot of time in the kitchen, sometimes up to 2 hours without taking a seat, shuffling around, and no sciatica for probably the last 2 months. So major improvement. Basically, I've got my life back.
The surgeons were booked me in a few weeks after my first session in Spine Plus for the IDD therapy. The surgeons didn't really think that there was any hope for such a procedure, but they said, try it. I'm glad I did, because I saw a difference from a few sessions after that. I started to see I was feeling something different each time, and then it really changed my life around the 15th, 18th session, where I saw a tremendous improvement from the treatment, and from then on I have been walking straighter, less pain, if really no pain.
Even after the first session, I would arguably say I had almost an 80 to 90% improvement in my symptoms, lower back pain gone, and that's continued to improve as I've worked my way through the sessions. I can thoroughly recommend it.
If you or anyone you know are suffering from chronic neck or back pain, sciatica in the legs or nerve pain in the arms as a result of damaged discs and joints in the neck or lower back, and think you may be suitable for IDD therapy, please call us to book your assessment appointment.